Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you nerve glides for radial nerve entrapment. Now, entrapment refers to pinching or compression somewhere along the path of the nerve, resulting in irritation, inflammation, and other symptoms. The radial nerve originates from nerve roots in the cervical spine. It runs underneath the clavicle and down the back of the arm, underneath the triceps muscle, across the elbow, and then down the back of the forearm and into the back of the hand. The two most common points of compression of the radial nerve are the radial tunnel in the back of the elbow, resulting in radial tunnel syndrome, and the radial groove underneath the tricep in the back of the humerus. Common causes of entrapment of the radial nerve include repetitive motions such as throwing, pushing, and pulling, as well as fractures of the humerus, the upper arm bone, and applying too much pressure for a long period of time on the back of the arm. Also, use of underarm crutches too high up in the armpit can cause compression of the radial nerve. Typical symptoms include pain in the lateral elbow and the back of the hand, weakness in the grip, wrist, and finger extensors, and numbness and tingling in the back of the arm and back of the hand. Limited range of motion at the elbow might also occur with more severe nerve compression. Among the many possible options for treatment of a nerve entrapment, this video is specifically focused on using nerve glide exercises. Nerve tissue does not like to be stretched, and pulling on both ends of the nerve at the same time does not help to relieve a pinched nerve. Instead, nerves respond well to flossing or gliding, which is to move one end of the nerve at a time, to gently mobilize the nerve along its pathway, and to free up the area of constriction or compression. These movements are performed gently with smooth and slow repetitions. There is no hold involved. Mild discomfort and numbness and tingling are common while performing the movements. These sensations should not be severe, and they should dissipate within a couple minutes of completing the exercises. During the flossing movement, if numbness and tingling becomes severe, then stop the exercise, shake it out, and rest. After the numbness and tingling completely go away or return to your baseline, then try the exercise again with slower movement and not going quite as far into the range of motion. See how your body is able to handle that, and once you get used to the movement, then continue building up repetitions. These movements should not be painful. If pain occurs, stop the exercise and rest. When you go back to trying the exercise again, be sure that you're performing it properly. Start with a slow, small range of motion and build up gradually. For best results, perform these exercises 1 to 3 times a day, depending on how well your body is tolerating the movement. Start with as many repetitions as you can handle and gradually build up session by session. You might start to notice some decrease in symptoms as soon as the first session or the first few sessions, but lasting improvement typically requires consistent daily performance for about 6 to 8 weeks. I'll start with a posture correction in sitting and then move on to the nerve glides. Sitting on a supportive surface, let's start with neutral pelvic alignment. Make sure that you're not slouched back or tipping your pelvis forward. Now moving up to the low back, make sure that you have your normal slight curve in your lumbar spine. Now moving up farther in the spine, lift your chest and relax your shoulder blades down and back. And do a little bit of a chin tuck, bringing your chin straight back so that your ears are lined up over your shoulders. Now the final step for the posture correction is to imagine a string coming out of the top of your head. Gently pull that imaginary string up to elongate your spine and to get as much space between each vertebra. This is a great starting point to maximize the motion available throughout your entire upper body. Between each set of nerve glides, be sure to reset and correct your posture. These exercises can be done sitting or standing. I'll demonstrate them sitting. The first nerve glide will be a floss at the wrist. Starting with your tall posture, bring your arm down to your side with the palm faced backwards. Reach behind you as far as you feel comfortable. Now with your palm facing back, Bend your fingers up toward the ceiling behind you. Pause and then relax your hand. Reach behind you, fingers toward the ceiling, pause, and rest. Again, lift your fingers up toward the ceiling, reaching behind you, pause, and then lower your hand, let your arm rest. Continue 10 repetitions. The second nerve glide will add movement at the cervical spine, or the head and neck. Starting with your arm by your side, with your palm facing backward, tip your head away from the side that you're working. So I'll start by tipping my head to the right. Be sure that you don't elevate your shoulder towards your ear. Keep your shoulders relaxed down and back. So I'll tip my right ear toward my right shoulder and pause for about a second. Now, as I lift my head back up to the starting position, I'm going to reach my hand behind me, fingers up toward the ceiling. Pause for a second, and as I relax my arm, I'll tip my head right ear toward my right shoulder. Pause. Now, lift your head as you reach behind you, fingers toward the ceiling, pause. And lower the head, relax your hand. Lift your head as you lift your fingers up behind you. Pause. Lower your head as you relax your arm. Make sure that you're keeping both shoulders relaxed down and back throughout the entire movement. Perform 10 repetitions at a slow and smooth pace, or as many as you feel comfortable starting with. The last nerve glide is a variation in position, holding the arm out to the side. Starting with tall posture, lift your arm out to the side with the palm facing backward, your thumb facing down. As high as you feel comfortable going, not above shoulder height though, so somewhere between about shoulder height and hip height. Be sure to keep your shoulder relaxed down and back. From this starting position, the first move is to tip your head away from the arm that you're working on. Lower your ear toward your shoulder. Be sure to keep your shoulders relaxed. You might feel a pull anywhere from your neck all the way down into your hand. Keep it gentle. Only move as far as you feel comfortable. As you lift your head, then reach your fingers back, bending your wrist so that your fingers are pointed toward the wall behind you. Pause, and as you relax your hand, then lower your head toward the shoulder. Pause. As you lift your head, then point your fingers back to the wall. Pause. Lower your ear to shoulder as you relax your hand. And lift your head as you point your fingers back to the wall behind you. Continue 10 repetitions, or as many as you feel comfortable to start with. You might notice your arm getting tired in this position, and it might be more comfortable to do 3 to 5 repetitions at a time, shaking your arm out in between repetitions. That's just fine. Or start with your arm a little bit lower. All right, that wraps up this video on nerve glides for radial nerve entrapment and radial tunnel syndrome. I hope you found these exercises helpful for decreasing your symptoms and help you get back to doing the things you love to do every single day. If you like this video, please give it a thumbs up and subscribe to my channel for more content that will be beneficial for you. There may be other points of pinching or compression of the nerve, especially in the neck. If you're having symptoms in your neck, please check out some of my other videos focused on the cervical spine. You'll find the links to those videos in the description below. If you have any questions or comments, leave them down below and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.